Hello everyone, my name is Dr. Hind, and this month being Cervical Cancer Awareness Month, we thought we'd just talk about the topic a bit and raise more awareness. So cervical cancer still poses quite a real burden in low and middle income countries, in that it is the third leading cause of cancer-related deaths among women. If we compare this to developed countries, they've managed to cut down the number of cancer-related deaths due to cervical cancer by about 70%. So quite a big difference. And this has been made possible by the uptake amongst the population of routine screening as well as the human papillomavirus vaccination. So cervical cancer is basically caused by a virus called human papillomavirus. You'll find that 99.7% of all cases of cervical cancer diagnosed have been shown to be caused by this high-risk HPV virus. So the thing about HPV virus is that it's quite a common infection and it's usually transmitted through sexual contact. However, also close skin-to-skin contact can make an individual contract the virus. Being a common infection, you'll find that by the time a woman is at the age of 50 years, almost 80% of women, 80 to 90% of women will have contracted the high-risk HPV virus. Quite scary statistics. However, the good news is that 90% of these women, by the end of 2 years, will have shed off the virus by their own natural body response, and it's only a 10th which persists in the body and then now has potential now to become precancerous and eventually cervical cancer. So the risk factors for cervical cancer basically divided into HPV-related risk factors and non-HPV-related risk factors. The HPV-related risk factors include factors like early age of sexual intercourse, and then having multiple sexual partners, multiple childbirths. With multiple childbirths, it just puts the individual at having more unprotected sexual intercourse and therefore a higher risk of contracting the high-risk HPV virus. We also have other risk factors like a history of having contracted sexually transmitted infections. So with this, that same individual is at a higher risk of also having contracted HPV virus. Also, a risk factor like having an individual who's a high-risk partner. And a high-risk partner is a partner who's had another partner who's either been diagnosed with cervical cancer or has been diagnosed with other sexually transmitted infections. Then there's also HIV infection and other steps which would confer the individual a low immunity, like maybe organ transplantation or other autoimmune conditions. Then the non-HPV related risk factors include low socioeconomic status, in that maybe the individual might not be financially able to present themselves early enough to a health facility, and therefore a diagnosis is not made early enough. Also poor hygiene, and then genetics as well as smoking. With smoking, it's key in that it helps with the persistence and integration of the HPV virus into the cervical cells, and therefore a higher chance of progression into pre-malignant cervical lesions or precancerous lesions and eventually cervical cancer. Yes, certainly. So this is where the role of screening for cervical cancer comes into play. And of note is that cancer of the cervix is not a cancer which develops overnight. It takes years, an average of 8 to 15 years. So initially, an individual would contract the high-risk HPV virus. As mentioned early on, by the end of 2 years, almost 90% of people will naturally shed off the virus. So a 10th will persist, integrate into the cervical cells, and eventually have the potential with time over years to become precancerous. So if a precancerous lesion is not now screened early enough and detected early enough, treated early enough, it now has potential over time to now become cervical cancer. And also, the other thing is that cervical cancer is at an area, being at the lowermost portion of the uterus, it's easily visualized by the practitioner. So it just takes a speculum. So the practitioner will just insert a speculum, and we can easily visualize the cervix, and the different screening methods can then be undertaken. So in our country, we have different screening methods. In an area where a lab might not be available, the practitioner just needs to insert a speculum. Then there are special solutions which are applied, and then we look at the cervix for any suspicious areas. These are then referred, confirmatory tests are done, and once confirmed, they are then treated before they now progress to become cervical cancer. The other screening method is one I think most of us have heard of, a pap smear. So for a pap smear, it will grade for us whether it's a low-grade lesion and a high-grade lesion. The high-grade lesions need to be confirmed and treated because they're the ones which are highly likely to progress into precancerous lesions and eventually cervical cancer. Then we also have the HPV virus DNA. So for a HPV virus DNA, we are able to detect the type of HPV virus. Is it a low-risk type? Is it a high-risk type? And we are also able to detect the type of high-risk type virus that we have. So it's usually the high-risk types which have the potential to now progress into cervical cancer. Of note to mention is that screening for cervical cancer is for an individual who does not present with any symptom at all. So an individual just presents at a health facility and just asks for a screening test to be undertaken. Once we have symptoms manifesting, most probably now it's no longer a precancerous lesion, and it's now progressed to cervical cancer. So the symptoms of cervical cancer depend on the stage of the disease. In the early stages, they might present with contact bleeding, in that you have bleeding after sexual intercourse, or intermenstrual bleeding, or abnormal heavy menstrual bleeding. Also, an individual might have an abnormal foul-smelling vaginal discharge. Then as the disease progresses, you might have additional symptoms depending on the organ that has been involved. So diagnosis of cervical cancer is basically a tissue diagnosis. So the practitioner just inserts a speculum. We are able to visualize the cervix and see the lesion on the cervix, and then we just take some tissues from the lesion, and then a test is done, and then a diagnosis is made after that. So cancer of the cervix is treated via different methods, and it all depends on the stage of the disease. The early stages of the disease are treated surgically, and there are different surgical techniques depending on the extent of the disease. So with this, depending on additional factors, there might be need for chemoradiation as well. As the disease progresses, then it's usually confined to either radiotherapy alone, or chemoradiation, or chemotherapy alone. So there's quite a number of developments, and they span across the different aspects involving cervical cancer. So whether it comes to screening for cervical cancer, it comes to diagnosis, treating, and the different treating modalities. So maybe just to mention a few is that in terms of the screening methods, currently what we have with regards to HPV virus DNA detection is that we are able to tell the type of HPV virus. However, there's ongoing attempts to develop a screening tool which will be able to tell us whether there's integration of the HPV virus into the cervical cells. So this is key in that the ones which integrate are the ones which have a high potential into progressing into precancerous lesions, and eventually potential to also becoming cervical cancer. So in conclusion, the goal is to detect cervical cancer at the precancerous stage. And how do we do this? Via screening. So my hope is that all women can present themselves to a health facility and just ask for any of the screening methods to be undertaken. Here at Nairobi East, we have all the screening methods that I've mentioned, and therefore you're all welcome to just walk in and ask for screening for cervical cancer.